Under the Affordable Health Care Act, is there the ability to, for a state to opt out if it chooses?
Recognized.
Thank you, Mr. Chairman. There are a number of opt-out provisions that many have exercised and are attempting to exercise, including corporations.
Follow-up? Representative Kriseman, you're recognized.
Thank you, Mr. Chair. It's my understanding that the state also has an opportunity to do that, and if that's the case, is there any reason why, instead of just sending a memorial that really is nothing more than an expression of feelings, we aren't, through your legislation, taking affirmative action if there's so much, if we have so many issues with the legislation that you're not taking affirmative action for the state to actually opt out?
You're recognized.
Thank you, Mr. Chairman. Yeah, this is just a choice to do a memorial, but I would accept your co-sponsorship if I did it next year.
You recognize
or just such an act.
You recognize, Kriseman.
Thank you. And Representative, since the goal of the act is to make sure everyone has coverage, have you sponsored or are you aware of any other legislation that's been filed this year that would increase access to health care for more Floridians?
Thank you, Mr. Chairman. You know, it's an excellent question, and you're right. Through the research of doing this, that was one of the inevitable outcomes of the question was, if this isn't the right thing to do, what is? And so in research of what might be the right thing to do, I've come up with a couple of things that maybe I will pursue next year as an alternative, because clearly the system that we have now doesn't provide as much as people would like to have, or as much access as people would like to have at the price they'd like to have, yet this Affordable Care Act seems to be hitting one part of it, but is so completely expensive. What's the right thing in the middle? So there are a couple of different strategies that I think may be able to be tried in the future. I would certainly like to explore them, including individuals being key decision makers in the healthcare system, making prices a little bit more transparent, making sure when individuals buy, they actually own their own insurance plan. You know, in America, when we buy a good or a service, we take ownership of that. If you buy a television and you put it in your house and then you sell your house, you get to take the TV with you. So having the ability to buy and own your own health insurance plan would be another, I think, step forward in both getting access to care as well as keeping it affordable for everybody. So, yeah, I've looked at them, and I'm excited, I think, in the future to be able to start exploring these.
Mr. Kriseman, you recognize for follow-up.
Thank you, Mr. Chair. Representative Williams asked you, just for us in considering whether to support or oppose the bill, whether there were any positive aspects of the bill, and you mentioned just one, and that was, I think you said that was the only one that you were aware of. So I guess my question to you would be is, would prohibiting insurance companies from discriminating against people with pre-existing conditions or extending the age for children to continue to be insured by their parents, is that, those would not be things you would consider to be positives in the bill?
Thank you, Mr. Chairman. Again, I think it comes with understanding that these things don't exist in a vacuum. When you define those things, it sounds very easy to say up here, but there are things up here like saying this grants HHS the authority to revise quote-unquote essential health benefits package. But they go on further to not define that at all. They go on to say that those things shall include the following general categories and individual items, such as ambulatory patient services, emergency services, hospitalization, maternity and newborn care. But what they don't actually define is the balance with which those services can be administered. You know, saying that they are providing essential benefits implies that there's some kind of quantitative measure that's there. The only quantitative measure that seems to be apparent in the Affordable Care Act are the penalties. Those employers that don't provide a lot of these essential benefits are subject to a $100 per day per individual penalty. If you have 100 employees, it's $10,000 a day in penalties for not providing what isn't defined. So I think in a vacuum, yes, that would be a wonderful thing, but I think the bill does a very poor job of defining exactly what that is, and there could be some more work done to it.